Hello everyone, I'm John DePaula, president of our physician practice, and I'm here today with Dr. Jason Mouzakis, our department chairman for otolaryngology. Welcome, Dr. Mouzakis.
Thanks, John. Happy to be here.
As you see, Dr. McKenna is not here today. We're filling in for Dr. McKenna.
That's right.
He's actually working on a college initiative. He's off campus with the dean. They're in the process of selecting who our Albany Prize winner is going to be. And the Albany Med Prize is actually one of the most prestigious, largest monetary award in medicine. So
Absolutely.
Dr. McKenna and Dr. Boulos off with some others in going through the selection process, which is pretty arduous.
Absolutely. Exciting stuff. That prize is, as John said, is a world-known prize and award, and it really is an important recognition, and it really puts Albany Med on the map. Really proud to be part of that.
Yeah, so as Dr. McKenna always starts off with COVID data, I'm going to sort of make this our own, and we'll do some COVID data that I think is relevant, that I pay attention to every day. And that really is the number of patients here in the hospital, our inpatients, who have COVID. And actually, for today, we have 45 inpatients with COVID. 11 of those are in ICUs. And that really is a downward trend. When I think back, Jason, back in January, we actually had upwards of 130 patients here in the hospital with COVID. So, you know, the trend continues to come downward as we are in June. And then also with staff absences. We're actually down under 50 staff absences for today. We have 46 of our staff members that are out with COVID. Again, Jason, when I think back in January, we actually had 660 staff out with COVID. So significantly downward trend as we're entering the month of June. And Jason, I don't know, there's still a prevalence of COVID that's around. Any thoughts about that?
Well, just to comment briefly, I think this video is very important when we review the metrics. I'm a bit of a weather geek, and I think our meteorology friends use many tools to help predict the weather, and these metrics are kind of like our barometer. And if you think about a barometer, high pressure, low pressure, gives us an inkling of what's coming. And so I think, as John mentioned, the trends are very promising, but we still have to have a high level of vigilance as we move forward.
Excellent, Jason. And really the big news this week on COVID is the vaccine for children under the age of 5 is out and being distributed. And Dr. Mouzakis, obviously, you're a pediatric otolaryngologist. Your thoughts about the vaccine for under 5-year-olds?
And this is a big, big development, as John mentioned. It really embraces another 20 million patients in our population. And specifically, as these variants continue to emerge, I think this week the BA4, BA5 variants are approaching 30% or so of the nation's prevalence. Last week it was about a fifth of that. So we're seeing a rising trend towards these more virulent and more transmissible variants. So it's really important for people to consider vaccination. I would absolutely consult with your pediatrician. There are very specific regimens for each vaccine. So Pfizer has a vaccine, Moderna, and there are intervals, the way that we distribute. Moderna is a 2-dose vaccine spaced between 4 and 8 weeks, and Pfizer's is a 3 to 8 week, 3-dose regimen, with the final dose being in excess of 8 weeks since the previous dose. So you'd want to consult with your pediatrician to discuss the schedule, but get on that early in the process.
Yeah, and again, Jason, as a pediatric surgeon, caring parents really, concerned and appropriately so about their children's safety. Typical questions that you get in the office this time of year about patient safety as it relates to pediatric patients?
Absolutely. I think that's pretty much weighs very heavily on a parent's mind is how safe is this vaccine for my young child? And I always like to relate a bit of a story. I'm Greek, and we like to be storytellers. And speaking of the Albany Med Prize, I was privileged and honored to spend dinner with Katie Carico, the doctor who helped develop the Pfizer vaccine. And when I spoke to her over dinner last year when she received the prize, I asked her how long had she been working on this platform, this idea. And she spent over 20 years working on this vaccine concept. Interestingly, when we think back to the origins of the pandemic, and in January of 2020, we were just learning about some of the tribulations and concerns happening in China. And when Wuhan released the genetic code, she spent a sheer 2 hours to literally create the vaccine. It took her only 2 hours to come up with a successful vaccine. So she had been working on this passionately for decades. And that gives me a lot of hope that there's a lot of thought behind it. It's a safe vaccine, impressively so. And so I would encourage all parents to seek that vaccine for their kids.
Jason, really excellent information. As you know, we've started to disseminate the vaccination for under 5-year-olds here on campus this week, and we're getting a lot of these types of questions from parents, and the information you share with us is very, very helpful. So thank you for that.
Absolutely.
Yeah, and the other news on campus relates to one of our longtime surgeons, a vascular surgeon, Dr. Clem Darling. There's been some recognition that Clem has recently received. So I don't know, Jason, if you want to tell us about that as well.
Sure. Dr. Darling's team is, as John said, world-renowned, and they were able to do the first Barostim device. It's a very interesting device targeting people with heart failure. And how it works is basically this device is attached to the carotid artery. So the carotid artery runs the length of your neck and has lots of purpose. But one of the receptors is responsible for blood pressure control. And if you think about it, if it is sensing certain factors, it may actually increase your blood pressure throughout your body, which really, if you think about it, your heart has to pump harder and harder and harder. And that's really what happens in these patients with chronic heart failure, is their hearts really struggle and fatigue. So by placing this device on the carotid artery, it senses blood pressure differently and really reduces what's called sympathetic tone, which is the kind of the neurochemistry of the body, and it kind of lessens the workload on the heart. And of course, it's a specific population. These are people that we measure heart output in terms of ejection fraction, and that's the efficiency of the heart output. And so these are people that are really suffering and have an inefficient output of their heart at about 35% or less. Dr. Darling, though, has always been a thought leader in vascular surgery. I want to share another anecdote. Love telling stories. When I was a mere medical student here in my first year, I wrote a paper with Dr. Darling's group and published it, and went to present it in Florida. And that was when I recognized that this group is internationally recognized. People came up to me left and right asking me, "You're a part of the vascular group of Albany Med?" And I was a mere medical student at the time, and who knows how our careers all turn out.
Yeah, well, Dr. Bouzakis, I mean, obviously, both you and Dr. Darling, nationally renowned surgeons here at Albany Medical Center, and we are very fortunate and very pleased to have you both. So,
thank you.
Great stuff. So as we transition from COVID into summer and we talk about that, one thing I want to kind of remind everybody about is that we started a process during COVID where we had some of our administrative staff start to help out in some of our busy clinical areas, in our clinical inpatient areas in particular. And this administrative staff would serve in roles of just doing patient sits or serving as hospital unit coordinators. Some of our staff with administrative responsibilities would help out on the units with clerical roles. We've actually started that up again for summer, given the dynamics of summer volume going up, right, related to staff wanting to be on vacation and take their vacation time. So we have some of our administrative staff now that are helping on the clinical units. And we just sort of rolled that out again this week. Sent out reminders to our staff that we were opening these roles up again. So I want to encourage our administrative staff, if you're up for helping us out on the inpatient areas, please reference the messengers that went out on Monday midday. Dr. Bouzakis, like I said, summer's here.
Summer is here. It's a fun time of year, and I think about the fun things that we do. My family, we like boating. I have a boat near Mystic, Connecticut. It's also a transition time, and I want to give a shout out to our residents, our house staff. It's the end of the academic year, and many are moving on and starting their careers. In ENT, ear, nose, and throat, we graduated 2 residents. There are about 300 or so spots in the country, so a very small number of people graduate and then go on to those careers. And I also want to welcome the new residents coming in. So July 1st is always a fun time of year. We really rely on this special workforce, and it's a most important part of our academic mission. So I recently had a chance to celebrate our graduates, and my charge to them, thinking about boating and summer fun, I think about 3 things that really occur in boating and how it might be a good way to metaphorically think about starting your career as a doctor. I think about, first, local knowledge. Second, safe harbor. And third, joy of the journey. So I want to touch on each of these items. Local knowledge is interesting in boating. Boaters rely on their equipment, their GPS, their radar, but it's also important to talk to the folks in your local harbor. They may tell you about things that have shifted, a channel that may have changed, and you may end up aground if you don't pay attention to the locals. And I would say the same is true in medicine. As doctors, when we go out into our practices, it's so important to look around, ask the people around you, the nurses that help you, our phlebotomists, our environmental service technicians. They all know, they all have local knowledge about the workings of the hospital. So I encourage our new physicians, keep that local knowledge close to you. The second, safe harbor. As we all know, traversing this terrible time of the pandemic, there are rough waters always ahead, and you need a place to return to as safe harbor. And so don't ever dismiss the import of your family and your friends and your loved ones. These are important pieces of your career development, and use those to your benefit for safe harbor. And then, of course, finally, joy of the journey. I think in career development, we often forget that the journey is about getting somewhere, but it's also the planning and the preparation. And as a boater, I always enjoy taking my boat on random journeys. I took our boat from Albany all the way down around Manhattan into the Long Island Sound, and it was a lot of careful planning, especially around the Statue of Liberty with cruise ships and all kinds of navigation challenges. But part of the joy is the actual journey. So I always tell our graduates, enjoy that first patient that you see officially as an attending. Enjoy all of the things that you face, even the challenges. So that's my message to kind of close out our graduates and start our summer season.
Excellent message, Jason. And again, I mean, you really hit on what summer means to us both here at the Medical Center with the residents starting up in July, and also in our personal lives as well. I love being by the water also. Nothing better in the summer.
Absolutely. Wear your sunscreen though.
All right, we covered some good ground here.
Absolutely.
I think we'll close out. Obviously, Dr. McKenna will be back next week, and we know how he likes to close this out. I don't know, Jason, you want to take it?
I think you take it.
Well,
I don't know.
How about we both
Go ahead. We'll
All right,
split
so
it up.
I'll
Perfect.
start with the first part of Dr. McKenna's sign off, and that is we really appreciate our staff that is here at the Medical Center, weekends, weekdays, 7 days a week, 24 hours a day. Thank you to all of our caregivers and support staff for all that you do at the Medical Center. And
of course, take care of yourselves, take care of each other. Have a great week.